Let's continue talking about interviewing headaches of internal origin. In headaches of internal origin, it is very important to differentiate between those deriving from fullness and those deriving from emptiness. The most common headaches from fullness include liver yang rising, liver fire, phlegm, blood stasis, liver wind, stomach heat, and retention of food. The most common headaches from emptiness include blood deficiency, stomach and spleen deficiency, and kidney deficiency. The headache from liver yang rising manifests with a throbbing pain, usually unilateral, often moving from side to side and located behind the eye, on the temples or on the lateral side of the head along the gallbladder channel. It is often accompanied by nausea and vomiting, dizziness, blurred vision, flashing lights, and a wiry pulse. The headaches from liver fire, which is less common, is similar in character to that from liver yang rising, but it is accompanied by liver fire symptoms and signs such as intense thirst, bitter taste, red face, dark urine, and dry stools. Another very common type of headache is that from phlegm obstructing the clear orifices of the head. In this case, the headache is dull and the head feels as if it was wrapped in or full of cotton wool, with a pronounced feeling of heaviness, muzziness, and blurred vision. Other manifestations include a feeling of nausea, a feeling of oppression of the chest, a swollen tongue, and a slippery pulse. However, in my experience, one of the most common types of internal chronic headache is that deriving from a combination of liver yang rising and phlegm, with the phlegm being carried upwards by the ascending liver yang. The headache from blood stasis is characterized by an intense, fixed, boring pain, usually unilateral, and accompanied by a purple tongue and wiry pulse. In very chronic, long-standing cases of headache, the blood stasis type of pain often may be combined with other types. The chronic recurrence of a headache in the same part of the head may by itself cause local blood stasis. For example, if a patient suffers from a liver yang type of headache for many years occurring always on the right side, this may by itself cause a local stasis of blood in the head on that side, and thus the headache will manifest with symptoms of both liver yang rising and blood stasis. The headache from liver wind is characterized by a pulling pain, accompanied by severe dizziness and tremors. The headache from stomach heat is characterized by an intense frontal pain and is accompanied by epigastric pain, thirst, sour regurgitation, and a yellow tongue coating. The headache from retention of food is characterized by a diffuse and intense pain on the forehead and accompanied by nausea, vomiting, sour regurgitation, feeling of fullness of the epigastrium, a thick, sticky tongue coating, and a slippery pulse. The headache from blood deficiency, usually of the liver and or of the heart, is characterized by a dull ache, usually on the top of the head, and is accompanied by dizziness, blurred vision, insomnia, palpitations, a pale tongue, and a choppy pulse. The headache from stomach and spleen qi deficiency is characterized by a dull frontal ache and is accompanied by tiredness, lassitude, weak limbs, loose stools, poor appetite, pale tongue, and weak pulse. The headache from kidney deficiency, which could be yin or yang deficiency, is characterized by a dull headache all over the head, accompanied by a feeling of emptiness of the head, dizziness, and tinnitus. Thank you for your attention.